All right, so as I said, these recordings will be available on youthpower.org. You can find our community of practice just on your screen. If you click on youthpower.org, you go to connect, you will find all the communities of practice pages over there, and you can click on Youth Systems Strengthening. You can find our work over there and how we communicate, and we will have some other resources for you in that spot. Next, please. All right, so we have a very interesting agenda today. We will have an overview of the Youth System Collaborative Framework by Bonnie. We will have the presentations from our two special guests, Nicola and Francesca. We'll have a short discussion, and we will have some coming up announcements at the end. So I hope that you enjoyed this session. Thank you for being here. Thank you for sharing. And as I said, if you have any question, if you have any comment, please write them in the chat. Or if you want to open your microphone, you just lift your hand and we will give you the chance to share so we can have this this webinar turn into a meaningful conversation to all of us. So over to you, Bonnie.
Thank you. Next slide, please. So we want to just provide an overview. Some of you may have been on other calls, but there is a group of international development organizations that came together almost 8 years ago to start the Youth Systems Collaborative. And through that work and us getting to know each other, it's, typically these organizations are in competition with each other, trying to go after grants and different pieces of work. But we've come together as a learning community to say we must really uplift what's going on around systems change. We wanted a place where we could share what people are doing in the different countries they're working in, from the different perspectives in the different sectors, where we can talk about not only where there's good program practice, but actually where systems are changing. And to do that, we came up with this framework that we've been using throughout the Youth Systems Strengthening community of practice through Youth Power, to have people tell their stories about their work they're doing in various countries, and to zero in on changes that have happened related to systems from the perspectives of policy change, norms and mindsets, everything you see in that circle. So we ask people who do presentations as part of this community of practice to try and zero in on one or two slices of this and let us dig a little bit into that. So could we go to the next slide? And these are, just to give you an example, the members of the network right now that we're working with. It's very exciting. There's a lot of collegiality, a lot of, there is a paper that was written that's out. We can share if people are interested. But if you look up the Youth Systems Collaborative, usually pops up. And trying to sort of actually continue to work and say, what do we have to, what are we learning, and how do we get that word out to people about how systems change is actually happening, both within a sector, but also comprehensively across sectors. Okay, the next slide, please. So over the last 3 years, almost 4 years, we've been having various discussions. You can go on the Youth Power site and look back into the recordings and sharing about what we've been presenting from various perspectives about systems change. And obviously, since COVID, there's really been an uptick in the focus on mental health, psychosocial supports, and actually mental health systems change, which has been very exciting for those of us who've been trying for years to get this really elevated up and be thought of as part of what we need to focus on related to ensuring positive youth outcomes. So we have two wonderful speakers today doing different work, but from some of the same perspectives. Nicola Chehade, who's with Making Sense International and is a senior specialist in mental health and inclusion, who will be providing sort of a more global perspective about what's going on related to some systems change in mental health. And Francesca Rawalisen, who is the founder and executive director of Omena, which she'll talk about, which is doing very exciting work in Madagascar. So we will jump right into this, and Nicola, get us going. Thank you.
Thank you, Mike and Bonnie, for introducing us and organizing this, and Catherine. Hi, everyone. I'm excited to be here with everyone speaking about mental health and systems change. So I will be providing, like Bonnie said, a more of a broad approach to what we're doing on the global stage, or some of it. What we've seen so far in development and some of the implementation work on of mental health programs is that we face several issues in implementation or design or just sustainability of mental health programming. Some of them are related to resources. Some of them are related to technical capacities. Some of them are related to marginalization, issues with marginalization, issues with discrimination, with stigma and stereotyping. Some of them are issues with lack of full understanding of cultural and local mental health issues and interpretation. We've also seen barriers related to lack of equitable access to people with specific needs, people living with disabilities, other underrepresented groups. And we've seen that mental health as a standalone, while it's very important, it's also important to take into consideration the human as a full entity in their needs and their capacities. So there is lack of this cross-sectoral integration of mental health, which is something important to happen. We also have seen in some countries that there is a slow integration of a rights-based approach to policies regarding mental health. So next slide, please. Some of these barriers, as it pertains to resources, to technical capacities, even to lack of access or equitable access, led us to ask the question, what's next? What can we do? What can happen? What's more sustainable? We know that one size of mental health solutions or programs do not fit all. Not everyone has the same needs or lived experiences, and not everyone understands or experiences mental health the same way. What the global conversation is gearing into is more of a systems approach to mental health. Next slide, please. A systems-based approach to mental health is, if you want, you can take a look at the picture. You can see the different circles, different colors. Consider the bigger circle is like the environment, or like a larger group, and the smaller circles are also groups but different sizes. Some of them are based on identity, some of them based on needs or location, for example. Some of our needs overlap, some do not. Some of our understanding or interests also overlap. Some of our lived experiences overlap, some do not. So a system strengthening approach combines accessible, that's one, and equitable, so more fair access to localized approaches. Localized approaches are generally community-based approaches, and with sustainable, inclusive, and intersectional policies to enhance mental health services. What does that mean is that a systems-based approach looks at the whole system and the different layers of the system, from the community, from the different groups, to the communication, advocacy, and then the policy making. Next slide, please. Based on the framework, the youth systems framework that Bonnie and Mike shared with us, this specific presentation specifically responds to policy, to data learning and evaluation when we talk about stakeholder collaboration, and to resource flows. Some of them also will touch upon capacity development a bit, but briefly. Next slide, please. We recently attended an FHI 360 Mindful Future conference, and the talk there, some of the speakers there also focused on more of a cross-sector collaboration in mental health. And some of the insight from one of the WHO representatives speaks to this systems approach. Basically, one way to look at mental health is not as a burden, but as an investment in better futures. To look at it as a more sustainable, for more sustainable outcomes and well-being and productivity and thriving. The way forward is indeed a multi-sectoral approach to mental health support. Siloing mental health support does not give us the results we're aiming for or the outcomes we're aiming for. One example that was mentioned of a multi-sectoral approach is integrating integrating some changes in, for example, agriculture, because in some countries pesticide is used as a tool for dying by suicide, for example. So what happened here is, for example, working within these agricultural system to effectively ban some of the pesticides, to reduce their use and to reduce their use in self-harm, for example, has yielded more of a positive results. Some other examples are integrating socioeconomic or livelihood programmings and workforce development programmings in schools and education, as well as psychosocial support. Next slide, please. To focus more on our work within Making Sense and YP2LE or IDAMS broadly with USAID and what we're doing on that front, I'm going to present around four different activities that we're doing. Next slide, please. One of the activities we're working on is a toolkit, and I think this one we can share with you and share the link with you. One of the toolkit is how to effectively integrate mental health and psychosocial support and services and considerations in youth programming. That was within Youth Power and YP2LE, Youth Power 2 Learning and Evaluation. So this toolkit provides, if you want, strategies and guidelines for program implementations. It focuses on the program cycle, so how you can effectively monitor your program, how you can implement, and what capacities you might need for implementing such programs, what kind of resources you might need in low and middle income countries and conflict-affected contexts. Next slide, please. Another toolkit that we're working on, this is still under press, it's not published yet, but we can share that once it is a toolkit on specifically focusing on mental health for marginalized and underrepresented groups. What does that mean is that we've seen that one size does not fit all. So these specific considerations for a different group, what does that mean? From policy to program implementation, to consideration for program design and inception and planning, to resources needed, from material resources, human resources, capacities. It provides a series of guiding principles. If you're not a mental health professional, let's say, but you want to implement a mental health program, what considerations you need to take into account to effectively design, implement, recruit, and monitor these programs. The toolkit has 4 sector pullouts, one for LGBTQI+ people, one for victims of torture, one for indigenous populations, and one for persons with disabilities. Next slide, please. Another toolkit that we're working on with USAID is a trauma-informed approach for youth programs, schools, and monitoring and evaluation within with Youth Excel as well and Unity in Ukraine. This toolkit provides guiding principles around the trauma-informed approaches principles, which are 6 principles. We can also share that with you in an email. The 6 principles focus on safety, peer support. Some of them are safety, peer support, agency, autonomy, etc. We built out the toolkit for monitoring and evaluation considerations and for creating the safe, psychologically safe environment in schoolrooms and classrooms based on these trauma-informed approaches. Each principle is accompanied by a scenario, and each scenario can be, if you want, studied or like just adapted by either educators or assessors. Next slide, please. One of the other documents we're working on is a series of documents within IDAMS, within Making Sense and USAID. The guidance documents on integrating mental health in other sectors. These guidance documents focus on exactly what we spoke on in the first few slides regarding a cross-sectoral approach. Some of the documents basically, let's say if you're working in the gender space, you're working in the education space, in the health space, the primary healthcare setting, and the democracy and human rights settings and governance, for example, what considerations you need to take into account to create more of a mental health focused approach in your programming. We have a series of guidelines around different levels of integration, community level integration, individual level integration, relational level integration, and more broader societal level integration. We have considerations around do no harm approaches and rights-based approaches as well. This is also under press. Next slide, please. Other examples from around the world, and these examples are taken from the WHO Mental Health Atlas that is published around, I think, roughly between 3 to 4 years. So the other levels are policies that governments are actually implementing. So next slide, please. A broad overview about where we are at since 2020. So the WHO member respondent states 53% reported the existence of standalone mental health or integrated mental health plans or policies. 60% are currently working or updated their policies from the last time they reported on it. And the Atlas reported that the highest percentages of countries with policies or plans for children and adolescents are from the Southeast Asia region. Next slide, please. One example of such policy is actually the Sri Lanka national policy. One of the strategies they focus on, I think it's under strategy 4, they focus on the adolescent health and well-being. They aim within schools and within other sectors. So basically, they focus on incorporating some of the global accelerated action for the health and of adolescent frameworks into the strategies within the schools and education systems in Sri Lanka. Next slide, please. Some of these strategies focus on capacity strengthening, livelihood strengthening, but also life skills. So soft skills, whether emotional resilience or well-being, whether working with parents or caregivers, ensuring safe spaces for parents, but also for students, how to create environments that are supportive, that are safe, that are trauma-informed, and how we can also integrate more emergency response within classrooms and education sector, but also in collaboration with parents, not only educators. So suicide prevention, anxiety response, or other type of emergency response that focuses on preventing harm. And I think that's my last slide. Next slide, please. Yes, back to you, Bonnie. Thank you so much.
Thank you. That's an awful lot of wonderful information. And if people have any questions you want to put in the chat, or if you want to raise your hand, if you have a specific question for Nicola at this point before we move on to Francesca, that's fine. We'd be happy to do it. Obviously, there's a lot of work in planning, but the emphasis seems to be growing on this, which is great because it's such an area that we've been under supporting and around the world. It isn't certainly in the United States and beyond for sure. Okay, so I don't see anything in particular. Mike, do you see anything in terms of questions?
Bonnie, just Amir Barry says very informative. Well done, Nicola.
Okay, well, thank you. So we're going to have another one. This is going to dig in a little bit deeper into what's going on in Madagascar through some great work that Francesca has been leading. Francesca, go, it's yours.
Thank you so much. Hello, everyone, and thank you again, Bonnie. It's nice to see familiar faces and names in the room. I am Francesca Rolison, and I'm the founder of Umena. And today I'm gonna share with you about the work that we do to break the cycle of emotional abuse, to prevent mental health in Madagascar through social emotional learning. And as background, I'd just like to share that So I am from Madagascar, not the movie, Madagascar, the island. We are the 4th largest island in the world, and we're known for our unique fauna and flora. And if you ever get the chance to visit, I definitely recommend to come. Now I'd like to take you back a little bit to a time that shaped the person I am today. So this is me at 7 years old. But what you don't see in this picture is actually the hidden reality of my life. I am a survivor of emotional abuse, and I'm going to share a little bit more about my story, which ultimately led to the creation of the organization Umena. So in my early years, I always thought that I was a problem. I was constantly criticized and humiliated by the adults and other children around me. And I felt like I was not enough and that I didn't belong. And the words, actually, they were not just words. They were echoes in my mind that really shaped my belief about myself and the world. And there's a particular memory that is a defining moment for me. It was an evening with my dad, and we were watching a movie. Everything seemed fine until he suddenly yelled. And those were his harsh words. And this is just one example of what happened back then, but it was reflective of my everyday life. And his words, his yelling tone, they didn't just hurt me. They taught me to live in fear, to walk on eggshells, to thrive for impossible perfection, to please, and basically to avoid being criticized. And this was the beginning of a distorted understanding of love and relationship for me. And that led me down to a path of mental health struggles, to low self-esteem, anxiety, isolation, and depression. And I experienced this type of trauma caused by emotional abuse until my early adulthood. And I did talk a lot about emotional abuse, but what exactly is emotional abuse? I'd like to ask you what comes to mind when you hear emotional abuse, and please feel free to share in the chat. I'd like to hear from you a little bit. I'll open the chat and try to see if I can catch your answers. Thank you, Bonnie. Fear. Thank you, Nicola. Walking on eggshells. Yes, belittling, attacking for no reason. Chastising of someone without cause and putting down their well-being. Yes, low self-esteem. Thank you. Thank you, everyone, for participating. I really appreciate it. Being manipulated. Yes. Thank you. Well, I feel like you've seen my next slide because, yes, emotional abuse is a form of psychological abuse. It is also, it is also called verbal, psychological, or emotional abuse. But in the case of Umena, we use emotional abuse because our solution is based on social emotional intelligence. And emotional abuse is invisible yet profound, and it manifests as repeated belittlement, invalidation of emotions, giving the silent treatment, control, and manipulation. And this can happen in any type of relationship. It can be at home, in school, in the workplace, everywhere. And it's a pattern of destructive behavior that creates invisible wounds. It's a systemic erosion of self-worth. So now let's put this into context. In Madagascar, according to UNICEF, there is 84% of children experiencing emotional abuse, and that's almost 10 million children. And this number it's only the reported cases of emotional abuse, so the actual number might be higher than this. In my country, it is a cultural norm. It is so integrated in the culture that we don't see it as wrong anymore. And this number was actually a wake-up call for me, and seeing as well through the research that there's 1 billion of children around the world who are also experiencing this, was a confirmation that emotional abuse is an invisible global pandemic that we don't talk about enough. And it creates intergenerational trauma, mental health issues, and it prevents people, communities, and countries from reaching their full potential. So in response to this, I decided to share my story, and I shared about emotional abuse being normalized in Madagascar in a video. And unexpectedly, the video went viral. It resonated with people not only in Madagascar, but from 13 different countries, including the US. And that's when I realized that it wasn't just my story, and that it echoed the experience of many others. And that was the seed from which Umena grew. We grew a community that actually formed organically, and we've been united by the same mission, which is to break the cycle of emotional abuse and heal. Now our mission is in our name. So Umena, it is a play on words in my native language. Umena, the entire word, which is our logo. It means give, provide, and the second part of the word, which means mena. Mena means red. So in this context, it is a red. We don't use red flags in Madagascar. We use red cards to say stop to violence. And through our program, we teach children, we provide them with the tools so that they can stand up against abuse. We provide them with the psychosocial support and emotional literacy tools to protect themselves through boundary settings and developing their confidence and self-agency. Now, this is our model. We recruit young adults to become community educators. So they are at the heart of our theory of change. They first go through our mental health prevention training, where they learn about the signs, the cause and consequences of emotional abuse, and where they receive the social emotional tools to heal and to improve their mental health and nurture healthier relationships. And then they go through our community of practice, which is a 4-month community of practice. It is a combination of a self-help group as well as a support group. It is a safe space where change of behavior and collective healing happen. It is where they practice their social emotional learning tools, they share best practices, they validate their emotions as well as others, and where they bring up difficult conversations while keeping each other accountable. And then after that, they graduate and they raise awareness to at least 50 people around them. That can be in their school, it can be in their workplace, or in their families or friendships as well. And after that, some of them go on and promote and share about our social emotional curriculum in schools. We're partnering with 15 schools right now for 10 months. They go through our social emotional learning curriculum. This curriculum has been translated, it has been adapted and made culturally appropriate for the children in Madagascar. And overall, our youth and also the children, they are the future parents. They are the leaders who will ensure that the cycle of abuse ends with them. This is an overview of our theory of change for a stronger emotional health and well-being. And as a byproduct, we have a happier, healthier, and more productive leaders, communities, and that's where the systemic change happens. Just a little bit of an overview that for the past 5 years, our approach has reached over 5,000 students. We have trained 250 educators, with all of them recommending our program, and 98% of them acknowledging that Umena has been the most transformative experience of their lives. And now I'd like to end by sharing how our model touches on the framework that we talked about earlier, that Bonnie shared. Number one, touching on norms and mindset. We cannot change what we are not aware of. So putting a name on emotional abuse is the first step in recognizing the problem. So when I first could put a name on emotional abuse, on what it was, I could see it everywhere. And to go back to my story with my dad, a couple of years ago, I shared the video. I sat down with him and I shared the video about emotional abuse, showing what it looked like. And I shared the video with him and I asked him what he thought about it. And he said that it was wrong. And and then I asked him, but do you know that you're doing this to us, Dad? And he lashed out and he said, what are you talking about? I don't do this. So I ended the conversation there. But a month later, he came back to me, my mom, my brothers, and I, and he apologized and he said, you're right, I do this, and my dad did the same thing. And really that apology was the beginning of the healing process for my dad, but also for our family. And that's about my family dynamics and norms, I would say. And we have seen similar changes in our educators' family dynamics as well. And the change of mentality starts on an individual level before it hits the collective. And at Umena, we reach the community through our awareness sessions where our educators share about the signs, the causes, and as well as the consequences of emotional abuse in schools, universities, and in workplace. And whenever actually we are invited, and that's where the integration of our training in other settings, like Nicola said, is very important because we do need to have the collaboration with the different stakeholders, which is number two, because number two in the list here, because the influence of our training that has been spreading has led us to have people from the workplace. We have parents even reaching out to us and asking us if we can provide them with the training as well, because now they understand that emotional abuse is really a problem that is impacting all of the different settings, and that we need everyone's involvement to break that cycle and to improve everyone's mental health. And lastly, our bigger vision has always been to incorporate our social emotional learning curriculum in the Madagascar curriculum. And we are currently in conversation with the Ministry of Education to do so. So in that case, we will be training teachers, school officers, parents, and this will hopefully lead to policy changes. We're not there yet, but that's where we want to go to after all the advocacy that we have done. So that's where I wanted to end. Thank you so much for having me.
Thank you, Francesca. I think somebody did put in the chat, just your story is so powerful. Thank you for sharing. And I totally agree. I've heard this now several times in preparation for our call today and our webinar, and then to hear it again in such a succinct and personal way is it's emotional. I feel emotional from listening to this and thinking about, you know, various things that have gone on in my own life, as well as the lives of a lot of young people who I've encountered. So first of all, I don't know if somebody has a question from the group where you'd like to raise your hand, or again, if you'd like to put it in the chat, we'd like to open this up if you have some specific questions. One of the things, yes, so if you can share any examples from your work. You came onto the call because you're potentially interested in around mental health systems and, you know, what's being learned. But if you have some examples that you'd like to share or some questions you have, if you think some part of the framework, let's see, would you like to say something, Nicola, about what you just put in the chat?
Yeah, I'm just saying that first, thank you, Francesca, for sharing that the personal and powerful story. And I have to say again and again, I admire the initiative that you did a lot. I just want to say that sometimes we discuss heavy topics in mental health. So we know that you're joining us from different areas of the world. So while we don't know what services are available around you, we just encourage you to, if some of these things resonated with you, there are some resources around you. We encourage you to search for them. We encourage you to talk to a trusted friend that you feel safe with, a mental health professional if you know someone, or if you know someone working in that space, we encourage you to talk to them to seek support or guidance. And we just want to thank you for listening in. That's the only thing I wanted to add, Bonnie. Thank you for just a note around emotional abuse and help seeking.
So I would put the question, if this is what, I don't see anything sort of coming up and I don't see any hands being raised. But again, please feel free. From each of your perspectives, you were giving sort of an overall, Nicola, and obviously the work you're doing in Madagascar, Francesca. Who do you see, you know, who are the key players if we're really talking about systemic change in countries where these issues are so difficult to talk about and so difficult to elevate to the level of thinking about it not just as a program, but about systemic change? who do you see has, who are the most important collaborators in that? And what do you see has this last question, the greatest potential to advance systems change for youth mental health? That's to you and Nicola and Francesca to start with.
Okay, well, I can start. Well, thank you for the question. Actually, I think for us, it really started with the youth only. We thought that if we could target the youth and having them as the future parents, they could break the cycle with them. But then we realized that as we were doing the work, we needed to have the parents involved. And then when we went into the different schools as well, we needed the teachers to actually understand what social emotional learning was and how important it was for them to also hold space for students so that they wouldn't perpetuate emotional abuse if the children had the tools. So we started understanding, I mean, I read about it, but when we really do the work, we really understand that it takes everyone's involvement to be able to put something in place. And I would say that at the end, understanding that the people who are putting the program in place, meaning the Ministry of Education, was the key player, I would say, that we needed to reach out to, because they are the one putting the curriculum in place. They are the one training the teachers. So in that area, having them as a key player was very important. Now, when it comes to the different, let's say, now that our educators have the tools, they are inviting us to different they are invited at different awareness sessions in the workplace. So even the workplace recognize that emotional abuse can be, let's say, a problem in terms of not creating a healthy work environment, and that can disrupt productivity. So also having the workplace be part of the conversation. We have been in conversation with the Ministry of how do you call it here?
Like workforce, employment.
Yes, in Madagascar, we do have a ministry that is in charge of all of the companies in Madagascar. So we are in conversation with them, but we don't know yet how it looks like. Is it training the employees or employers, I'm sorry, to be able to have them be aware in the first place and see the impact? We're still in conversation there, but I think trying to pinpoint who are the decision maker on the higher level and having them on board is has been our part of our next steps.
Mm-hmm.
I have to agree with Francesca 100%. The key decision makers is they are big important players that can shift and sway the decisions around mental health, especially the decision makers who are not working directly in mental health. So like the Ministry of Education or schools, like Francesca said, but other sectors as well is very important. Another thing would be, I think, in other programmings, it's important to have a cross-sector collaboration. So while not focusing on, let's say, a program focusing on mental health alone, it's important to have a consideration to earmark some funding regarding integrating mental health, or to have one person on board that can provide this angle or perspective around mental health. Because as a standalone programming, while it is very important, it's not enough, and it cannot cover all the needs. And we cannot do that basically alone.
Mm-hmm. Yeah, one of the things I think we've found over time in other systems change efforts, I've worked a lot in child welfare and juvenile justice, is that, and some in special education, is that when people have a personal connection to the issue, which maybe they wouldn't necessarily be willing to admit in the world that they are, in terms of being an executive or being a mayor or being a, county executive or the head of a ministry or whatever. But when you get people to start to talk about their own personal experience, like you did, Francesca, I think it can lead to, I think a lot of people don't want to see themselves as having been a part of breaking the law or being in the foster care system. But when you start to talk about behaviors and feelings and things that happen to them, they can begin to identify with it. And I just wonder, as a global community that we're all involved in to trying to ensure more positive outcomes for young people, where do you see and how important do you see this personal connection is to getting systems change?
Okay, Nicola, your turn.
You go ahead. You unmuted.
Okay. Well, I totally agree with that, Bonnie, and I think that's why I wanted to start with my personal story, because I found it very a human way to connect with people, because at the end of the day, we're doing our work, but we're still, yeah, we are human. We have emotions, and I try my best to connect and let them know that by sharing my story, actually, they do see themselves a little bit in it as well. And it confirms the numbers, the 80%. And I think starting with it has been the way for us to start those very hard conversations and actually bonded us to even get deeper into wanting to solve it, because we realized that in my case, we are very focused on emotional abuse as one of the factors leading to, poor mental health, but there's so many other, factors, but that's what we want to focus on. But whenever we talk about it, there's always, a very, very beautiful conversation at the end of it. And they do share sometimes that, oh my gosh, I've been through this and I know how it impacted me. And that can be from, teachers, that can be people in the ministry as well. So I think starting with it has been very crucial for us.
Yeah.
I do believe, yes, echoing Francesca and you, Bonnie, what you said about personal stories, people will resonate with personal stories because we humanize the experiences more. We put an aspect, we kind of, it's like storytelling, and people like storytelling. Now, that being said, I think we've heard that in different discussions in the FHI 36, like the Mindful Futures Conference. This was brought up in the Positive Youth Development Mental Health Panel discussion in January. This was brought up as well. I think it's also about branding and how you can brand mental health. Not everyone would understand mental health 100% the same. And we're not asking everyone to have a same understanding of mental health. The issue with branding is that what matters to the people we're trying to work with. So if it's in education, what matters to these people? If it's in finance or in workforce, what matters to these people? So for example, we have statistics already showing that mental health and some mental health concerns and problems, some mental health issues, people living with mental health concerns, for example, have a negative impact on, for example, productivity, let's say. If that's the angle that, for example, the minister, the workforce development teams, or Minister of Finance or Workforce or Labor, work is focusing on, or is what matters to them, we come at it from that angle. So in addition to storytelling and what resonates with people, it's also a branding, an issue of branding, or how we can, quote unquote, explain mental health in terms that the other can understand.
Yeah, I totally agree. Just to add into this, when we first introduced our curriculum in the schools, we didn't talk about emotional abuse. The approach was different. It was, let's teach our children about healthy relationships. Let's talk about emotions, because we assume that teachers didn't want to hear hey, this country is very emotionally abusive, and the school is as well. So I think the approach is very important too, the way you talk about it, and also the outcome of it, how it's going to help the children reach the same goal as the school also has. So yeah, just echoing on what you said, Nicola.
Right. Catherine asked Nicola maybe about, you talked about two projects that Making Sense is doing, the Unity and the IDAMS. Maybe briefly explain how these projects are addressing mental health.
Yes, so For IDAMS and Unity, we talked about school-based scenarios and education, like school-based scenarios, but also research, so monitoring and evaluation scenarios for trauma-informed approaches. While we haven't presented the trauma-informed approaches in these slides, we're happy to share some of the resources around what trauma-informed approaches are. It has 6 principles that, while they're not relatively new, if you hear them, they resonate with us for like a more combined together. They lead to this shift in our approach. So it focuses on creating safe environments, focuses on creating agency, autonomy. It focuses on creating peer support, peer-to-peer support, but it also focuses on resource allocation and all of that. So all of these kind of principles combined together, what we call a trauma-informed approach, focuses on mental health and well-being. What we're doing by that within Unity is that, like, we're saying to educators, like, while you're not a psychologist, you might have a psychology background, you might not, or social work background or not, or counseling background or not. These approaches are combined with scenarios and strategies are some, if you want, guiding principles or examples that you can use in your classroom to foster student well-being and sense of safety and belonging. And we see once students feel the sense of safety, the sense of belonging, of acceptance, we see more we see well-being, we see more positive well-being, we see thriving within well-being that is thriving, we see better participation and engagement in schoolwork and classroom, and we see better collaboration. And these approaches focuses on group collaboration, based collaborations as well. So while not per se focusing on treating specific issues within mental health, it focuses on creating an environment that is psychologically safe. That's how it responds to mental health. For the research aspect, it focuses on how you can ask questions or approach interviews from a manner that is not triggering to the other person, or how you can create this environment where you can ask the question and respond appropriately in case of arising needs. For IDAMS, what we're doing is creating these guidance documents that focuses also on non-mental health professionals, not the clinic and the clinical aspect. So if you are working in education, what type of consideration you need to focus on an individual level, relational level, community level, and more broader societal level. For example, societal level, we have policies that focuses on integrating mental health in schoolwork, for example. Advocacy efforts and campaigning. For individual level, we have more one-on-one groups, one-on-one support. Relational level, we have more group work, for example. Community level, we have community-based volunteers being trained on psychological first aid, let's say, something like that. I'm giving a broad example of considerations. These are how both of these activities focus on different aspects of mental health. Thank you.
That's great. Well, we're going to be winding down. Thank you both for really providing us with some hope that this issue, which has been stigmatized for so long and really sort of pushed down when we've been thinking about sort of holistic approaches to youth, even in the whole positive youth development approach, the whole aspect of really focusing on mental health and how it impacts all the various systems, education, workforce, the health system, the connections that we need to be making, but elevating this up in a positive way where and recognize that this is such an issue that, everyone has to be dealing with, and everyone has issues. And I do think that COVID did sort of like push this up, but we have a lot of work to do to make sure that we maintain the positive focus on this and get things done. So thank you for that. And thank you both for taking the time to do this. Mike, do you want to sort of wind us down here?
Absolutely. Thanks everyone for joining us. And I would like to read Megan Bolton comment. She says, thanks so much for sharing. I really appreciate the system change focus on the mental health of youth. Right. Thank you very much. And I don't want to close up this meeting without thanking Nicola, Francesca, Catherine, and Bonnie, and everybody who joined today. We have some news advertisements for the coming up next session. We have the Youth Engagement COP Peer Connection and Networking session happening on Wednesday, this coming Wednesday, May the 1st, tomorrow. This virtual event will provide an opportunity to meet other youth engagement practitioners, share knowledge and expertise, and create connections across the sector. And we have, throughout May and June, our community of practice will be sharing some blog series about different topics, different areas from different agents of change around the world, and how their practices, how their works are linked to the youth system strengthening community of practice. And I hope that you visit our website in youthpower.org. You can find the group over there. You will find the link in the comment, and please follow us and join us. Thank you very much for joining today. Thank you for sharing. Thank you, Nicola and Francesca, again, for talking, sharing, and helping us understand more about this practice, this issue, and everything that you do in your own countries, your own communities. I always say that, changes around the world are just one community at a time. Thank you for changing that. Thank you for changing those realities for people that are benefiting from your projects and your initiatives. Thank you very much. Thank you, everyone.
Thank you, everyone. Have a wonderful day, evening, wherever you are. Okay.
Have a good one.
Yes. Thank you,
Muchas
everyone.
gracias a todos.
Thank you. Bye. Thank you, everyone.
Okay.